Hi, welcome to Med Medicine with Miss P. And I realize that they're gonna start up again and attempt to do the big control all over again. So I'm sure this questionnaire is only going to get worse. But we have a little COVID questionnaire on our uh, forms that you fill out online, and I don't understand what's so tricky. It's really not. It's really simple. It starts with very simple, clear COVID related questions. If you have any of these symptoms, and it's all symptoms that, some of us have from time to time and some that are obviously COVID related. But the questionnaire in general is asking if you have it, if you think you have it, if you've been around people who have tested positive, or if you have any of these symptoms specific to this disease, which means, can you stop checking yes to muscle aches and headaches? Everything is no, and then you check muscle aches and headaches. Okay, if those are things you've had off and on for the last 10 years because you're 50, stop checking them in this particular survey. It- that's just dumb. Clearly you understand that what we're trying to identify is if you have symptoms of this particular communicable disease that is headed at the top. It's titled plain as day. This is what we're talking about. So if you have headaches from time to time or muscle aches, that means you're 50. It doesn't mean you have COVID. I have to go through there and correct them all every time. There's no reason to do that. That red flags everything immediately. Surely there's got to be a little tiny part of you that understands that. And still, every time. Okay, so God, and I hate that I have to bring this up. This whole video is going to be about this one guy. I love this guy. He's so cute. He was a Navy SEAL. He's a great storyteller. He's on YouTube. I've talked about him before. I'm sure you've seen him. I love him. He's great. But I'm starting to think that the stories he gets or researches, they're just not real. Some of them are ridiculous, and I believe crazy stuff happens. I'm not going to say they don't, but some of this stuff is just so ridiculous. Okay, so now the most recent one was this. The story he tells is that there was a motor vehicle accident, and this guy is paralyzed for whatever reason. Okay. So he is so badly injured that they take him, and this was in like a foreign country, they take him directly to the emergency room and they decide that he needs emergency surgery. So he has emergency surgery, but he's awake for the whole procedure and he can feel them cutting. And okay, listen, I'm not going to say that people don't wake up during surgery. It happens all the time. It's usually a monitored anesthesia care situation where we want you to wake up, or you're so light that if you start to wake up a little bit, they just, give you a little bit and put you back down. That happens. Sometimes we need you awake. We need you to, look side to side if it's eye surgery, or, see if you can feel this or if you can hear this, depending on what the procedure is. That's totally normal. So the whole I woke up during surgery thing, yeah, we realize that. But if you think that this person is going to have, like, it was like an abdominal cut that they were doing, that he wouldn't be under general anesthesia. Now, is it possible to wake up under general anesthesia and be aware and feel everything? I can't help but say no in just my 30 years of experience, to where you have a tube in your throat. And I've said this before, like, I have choked on a drop of spit, and you're like hacking and gagging and coughing. You can't like even open your eyes, and they're watering like crazy, and you're panicking because something inadvertently went into your trachea. So a big giant tube that has a balloon that's inflated in the center of your trachea, usually when you're waking up or coming around, or your brain isn't as asleep as we need you, your consciousness isn't asleep as we need it, you kind of see it right here. Like, they call it bucking on the tube. I've heard anesthesiologists say it, and surgeons say she's bucking on the tube, like during a facelift or whatever. My surgeon was saying, like, she's bucking, put her back down, put her back down. This person's eyes aren't open and they're not aware of what's going on. They're just barely starting to have the reflex of that tube in their throat. Now, is it possible on a level that they're awake enough to feel the cutting. Maybe, I guess, I'm not going to tell anybody what they did or didn't feel. I totally believe in like the near death experiences. If you haven't already seen that, I've said this before, go on Google and listen to these stories of their near death experiences. It's really amazing. I will always believe in a higher power. I will always believe that your body is just your body and your soul is something completely separate, and it could be separated and like I'm into all of that. I'm not saying that's not happening, but the fact that this guy is paralyzed but still alive, the big issue here is that you have a diaphragm. And if you're paralyzed longer than 3 or 4 minutes, you're going to lose oxygen to your brain, and then you're going to end up with permanent brain damage. I just watched another video on that specifically. That, I mean, it was that crazy lady in the UK that was murdering infants, and she was a nurse murdering the infants, and one of them ended up with like severe brain damage because they went without oxygen for like 4 minutes. That's all it takes, like 4 or 6 minutes. So you can't be totally paralyzed. Oh, and he didn't have a pulse. Yes, I remember that. They couldn't find a pulse. So the doctors operating on them, the anesthesiologists, the nurse anesthetists, all these people surrounding this, but none of them could find a pulse, but he was alive. I mean, all right, maybe it was that faint. I don't know. But he was paralyzed but could feel everything, but his diaphragm wasn't paralyzed, so he was still breathing. All his thoracic muscles were still working. No, I can't. I love this guy, but it's like everything he says is a lie. And the fact that he can never say lie. He can never say the word lie. He was laying there. She was laying there. She was laying there. They laid her down. No. You lay an inanimate object. Like you lay your purse on the bed. You lay the book on the table. Maybe a sorority girl gets laid. But actual live things that can lie down, they lie down. A cat will lie down. A dog can lie down. A horse can lie down. A human lies down. He was lying there. Or she was just lying there. Or they lie down. Quit saying lay. He said, not one time. Can you ever say it right? Not one time. Still super cute. But I had to unsubscribe because I can't take it anymore. Yeah, so oh yeah. So then they decided that he was brain dead, so they were going to harvest. That's what it is. Maybe he didn't need surgery. I think they were harvesting his organs, and he was brain dead. No, this was a different story. No, I'm sorry. This was a different story. That the son. Okay, yes. So here's another one. Oh God, this is even worse. So, and some of this may be true. I don't know. So the son was in some sort of, this was a completely different story, that this man was in some sort of accident where he was brain dead, and all the family said, okay, we'll take him off the machines. But the dad was like, no, you're not taking my son off these machines. I refuse. And he went and got a shotgun, and he like stayed watch over him. And they were like, we have to hurry and harvest his organs because he's brain dead. So we have to hurry up and save the organs. If the body is alive, it doesn't matter if the brain is dead. You're not going to do a brain transplant. But they were all over the dad because they wanted to hurry up and take him off life support so they can harvest his organs, because apparently the organs weren't going to survive in the body. That could stay alive on a machine for who knows how long, but they had to hurry. So he went out and got a shotgun, and he stayed watch over them. And what do you know, like 3 hours later, the guy opens his eyes, suddenly comes out of his coma, and the dad saved his life because otherwise everyone else was going to take him off the machine. Maybe, but I'm going to have to say no to that one also. So, okay, that's enough on my poor YouTube guy I'm attacking. And again, wouldn't kick him out of bed. He's super cute, probably could save my life, loved to death. Great storyteller. He gets into it. But I got to say no on these stories. I can't take it. Okay, so on another one of these forms they fill out, my girlfriend, one of the coworkers, told me that the patient wrote down that they had a malicious melanoma. Not funny, because melanomas are not funny, but this one was particularly malicious. It was also probably malignant, but malicious as well as malignant. You know how those melanomas can be. Oh, happened. You know what? I can't even. I don't know that I could pronounce this correctly, but this is a surgery this person had. So I had to write it down exactly as I saw it because there was no fixing this. They had appendicitis. I think that's what that is. Appendicitis. Now, my handwriting isn't any better, but yes, they had appendicitis. That can be very dangerous. Not as dangerous as a malicious melanoma, but still equally. Also, when we ask you what kind of surgery you have and you said, I have macular degeneration, that's not a surgery. Disease processes are not surgeries. You know, just like I said last week, breast cancer, that's not a surgery. There's like 10 different surgeries you could have for that. And I don't know what surgery they do for macular degeneration, but that's not the name of a surgery. Yes. And I get this a lot. When's the last time you had an aspirin, ibuprofen, Motrin, Advil, Aleve, BC powders, anti-inflammatories like that? Well, I had some Tylenol yesterday. All right, congratulations. But when is the last time you had any aspirin, ibuprofen, Motrin, Advil, Aleve, or BC powders, or anti-inflammatories like that? Well, no, I take Tylenol every day. All right, for the love of God, sir, Tylenol, not an anti-inflammatory. It's not aspirin related at all. That's why you're allowed to take it. Can you just tell me the last time you took your aspirin? Oh God, I really, I don't know. I haven't taken it in a really long time. Okay, like how long? I have to put a date in here. Give me a time, like years, months, days. God, it's been just a really long time. All right, thanks. Thank you so much for that. I'm just going to make a date up now. I appreciate that. And I don't understand why you can't help a sister out and just give me some numbers, even if it's been 6 months. But they act like you're pulling teeth. I don't understand what they don't understand. And even like we have to ask them when the last time they had their beta blocker is. Like, well, I took it last night. I said, right, what time? Oh, just after dinner. Okay, well, what time was dinner? I don't know, maybe 7 or 8. Okay, so you took it at 8 or 9? Yeah, maybe. Okay, the anesthesiologist has to record this. We need to know the time, the last time you took your beta blocker, and it's literally like pulling teeth. I even go like this, I kid you not. When was the last time you had something to eat or drink? I literally will say it like that. And they say, last night. Every time. Every time. And I say, yes, of course, but what time? At dinner time. Okay, what time was that? 3 times it takes me to get this every single time. No joke. And then this other lady said, when's the last time you had your aspirin? She's like, oh, well, I took it this morning. Okay, did they tell you to stop your aspirin? Uh-huh. Did they tell you to stop it 5 days before your procedure? I think so. But you took it this morning and surgery's in 2 days? Oh, yeah. Okay, they might cancel you. There's a risk of bleeding with this particular procedure. Are you just like they just do their own thing? Or they'll say, yeah, I stopped all my medication 5 days ago. They told me to. No, nobody told you to stop your diabetic medication, your blood pressure medication 5 days before surgery. Nobody told you that. Yeah, they told me to stop this and this, so I just stopped everything. Okay, so you're right. You decided to stop everything because nobody would have told you that. Yeah, stop thinking and just do what you're told. That's a really bad idea. Now, if you want to look it up and learn and understand how your medications work and what to stop and when to stop and why, that's one thing. But otherwise, I can't, you guys. I can't. Oh, yes, this. Now, you know what? I dig this. I actually like this. This one woman was explaining to her husband about her husband, and she said, well, you know what? I don't really know what they call it, but I just put on there an exploratory angioplasty. Which, technically, that's kind of right. They're going in there looking for a blockage. It's exploratory angioplasty. That's a thing. That's totally impossible. Totally possible. This other lady thinks she had back surgery at S1 to T something. So your entire low back, you're just like 7. You had a 7-level back surgery from S1 to T1, T3, T12. What? She has no idea. Oh, and one of these medications give this patient thoracic hives. All right. That's, hives on your trunk, your thoracic. Okay. I'll take it. Thoracic hive. It's almost as good as Donna saying that a patient takes arthritic Tylenol. That's fine. That is adorable. And then same as always, I got this one again. No surgery. No, I haven't really had any surgery, at least not in the last 3 years. So you've had surgery? Yes. 6 surgeries later, but they weren't important. And then had a back surgery, wisdom teeth, and okay, every time when we get to the kidney part. No other surgeries? You sure you haven't had any other surgeries? Not even like ear tubes as a child, tonsillectomy, nothing at all, organs removed, hysterectomy, nothing? Nope, nothing at all. Okay. And then we get down to the questionnaire part and we get to the kidneys. Any chronic renal failure, kidney stones? Oh, yeah, I've had a lot of kidney stones. Okay, you passed them on their own? No, they had to be taken out. Okay, was that by osmosis or did you have surgery? Like people don't realize what surgery. I even say stuff like, "What procedures have you had in the past that required anesthesia?" So I can at least like narrow it down. They literally, I can, there are no words for real. Like you can't get them to understand that that is actual surgery. It is stunning. And I already told you about the providing attractive, pleasant nurses. That may be my favorite thing ever. Yep, you can't make this stuff up. It is fantastic. And here's here. Okay, so my last thing, and then I got to go, and this is all done. I don't understand what people don't understand about the whole partial and total hysterectomy. Your hyst is the tissue of your uterus. That's it. That's all there is to it. A hysterectomy is your uterus. Okay. Could you all spread the word and tell all of your moms and grandmothers and great grandmothers and aunts, for that matter, stop telling me you had 2 hysterectomies or that you had a partial, then a total. Your hysterectomy is your uterus. That's it. I know the doctors use those terms and, don't get me started. They use a bunch of other terms that I want to throw punch them for, but either you had your ovaries removed, which is an oophorectomy, or your tubes removed, which is a saphenectomy, or your uterus removed, which is a hysterectomy. Your partial hysterectomy where they left your ovaries, no, your uterus is gone. That's all I care about. If your uterus is gone, you don't have to do a pregnancy test. That's all that matters. Quit with the tubes and the ovaries. Nobody cares about that. If you had an oophorectomy, then great, and I'll write that down. But quit telling me whether you had a partial or a total. Now, when you bust out with the TAH, BSO, cool. I already know you're a nurse. I write it down, and that's fantastic. But the whole partial hysterectomy, what parts were left? Your uterus? You have a uterus? Okay, then no. Then you had a hysterectomy. Who says these things? None of it makes any sense. Or, maybe they left the cervix. Don't care. You're still not going to be able to carry a baby. Is that what a partial hit? I can't. I have no patience for it. I can't deal with it. So, as always, face your fears, forget your failures, follow your faith. Love y'all.